Hi, this is Sarah Reese from Polk County Public Health, and I've recently been asked about the learning model for Polk County, so I want to spend a moment visiting with you about that. Our current learning model is one where students in the older grades are in a hybrid model, so they're not coming into the school building every day, and our youngest learners, pre-K through 6th grade, are in an in-person environment. If you look at our 14-day case rate over the last couple of weeks, that rate has increased and is now over 20. The reason that's important is because in the Minnesota Department of Health guidance, that would indicate a recommended policy change or a change in that learning environment from one that is currently a combination of hybrid and in-person to having all students in a hybrid model. That presents some challenges, one, because we know that our youngest learners do best in an in-person environment. Of course, it is most ideal for all students to be in an in-person environment. So when we look at our youngest learners, we know the mental health and physical benefits of students being in an in-person environment. We also know the impact that it has on administration and staff transitioning to that hybrid or distance model. And certainly we recognize the impact that that has on parents and on childcare. And so our goal is to keep our youngest learners in an in-person environment as long as we possibly can, and hopefully to continue into the future. So what we have to do is take that 14-day case rate as one data point. It's one piece in the picture. So if I draw a picture, it's essentially like taking this data point and I place it. So that's a focal point. But what we also have to do is we have to understand all of what's going on in this bigger picture in Polk County. So we have to zoom out our lens. So then I'd like to point you to our weekly data report where we update the age ranges of cases by decade. And what we do there is we take a deeper dive into that data, zooming out into the bigger picture. So we look for things like geography. Where are the cases happening? We look at, of course, the decades. Is it our youngest learners that are most impacted, or is it our older decades that are most impacted? And then we certainly look at transmissibility. What is happening in our school buildings? What is happening in our communities? What is happening from events that are being held, and so forth. And so we take a bigger look at what is happening in our community and what is potentially impacting the public's health. Based on the current data, my recommendation is to continue in the current model that we have, because if you look at the data tells a more full picture when you break it down by decade, as well as when you look at the trends and projections for the future. So as of right now, my current recommendation for school districts from a public health epidemiological perspective is to continue to have students, our older learners, stay in that hybrid environment, and our youngest learners to stay pre-K through 6 to stay in an in-person environment. We certainly recognize, and we definitely look at the data across all decades to understand a full picture when making this recommendation. Thank you and have a great day.